One of the questions that has come in is, could you discuss the role of structural racism in conducting research itself? And how do we deal with it and also take it into account as we conduct our research? Not an easy question. Tanisha, do you want to start?
I'd like to jump in. I think a lot of this comes from learnings and talking to the partners that we have. But I think, first of all, it starts with who is conducting the research, who's on that team, who's in the room, and who understands the frameworks that need to be included in this type of research. I think the priority study is a really beautiful example of what that looks like, where we can move beyond just understanding the demographics of Black, white, et cetera, and really saying, well, what does it mean for what questions need to be asked so that we understand the experience of a Black person accessing pregnancy care and in the midst of COVID-19. And the people who inform that are folks in community who understand and are providing direct care, especially at the time when hospitals people weren't able to access their care in the same way that they were before COVID hit. So I think it starts with who's on the team and also, what's driving even the hypothesis for that research, right? What is the main question that people are pulling in and where are they starting from? And if it's just one where it's about, Black women are this, they're more likely to have this just because they're Black. If people are starting from that frame, then you have a lot to do to get to a place of equity.
Thank you. Thanks a lot. I'm wondering, Juanita, how this issue has been brought to bear at NIH.
Sure. There's some published work from NIH folks that shows that types of research that are prioritized plays a large role in how structural racism can impact research. There's less kind of emphasis on health disparities research, and the types of researchers that do health disparities research tend to be researchers of color. And so those are ways that we see it impacted through the funding process, and that research and those researchers that do that type of research may not be prioritized. Also, there's some published work, but additional published work showing how research is reviewed. How do we review and prioritize and value certain types of research, and what type of biases can we see in that process?
Thank you. Any other comments? If not, I'll go to the next question, which really has to do with what do you consider to be some of the largest gaps in the field that we need to fill in order to really advance where we're heading? What are some of those data needs? You've highlighted some of that in your talk, but it would be really helpful to underline and reinforce the crucial gaps that need to be filled.
To jump in here, I think identifying and highlighting the gaps in funding that support research and creating measures in maternal mental health, identifying what those gaps are. Just also to note that equally important how the work is funded, and that's important in terms of our working on areas that are not receiving as much funding or attention. And so that being said, there's a dearth of funding to improve access as community providers, including birth workers, midwives, lactation consultants, and community health workers. Improving access to these non-traditional providers is essential to improving outcomes as these providers feel oftentimes systems gaps by providing whole person and center pregnancy, perinatal and postpartum periods. There's also around maternal health. It's the most common pregnancy complication for all birthing people, but disproportionately impacts birthing people of color. And mental health needs have been exacerbated by COVID-19 and issues surrounding racial injustice. So funding related to improving maternal mental health that appreciates the intersectionality of the issues, including economic justice, community resources, child health and well-being, housing instability, intimate partner violence, immigration. I mean, the list goes on, is really essential. And it's important that we fund these efforts in an intersectional way, because the more that we continue to fund equity work in silos, the more fractured the ecosystem becomes, and then we're less effective at improving conditions. So those are just a couple of areas that I would love to lift up.
I would echo a lot of that. I think when you think about maternal health outcomes and infant health outcomes, if you're not looking at sort of the environment that someone is in and what is of value to them and what kind of supports that they need, then we're not going to be able to make an impact. And so, you know, a lot of this related to sort of how do you overlay, Dr. Chin has, and I have talked about this before in other venues, like if you overlay data sets, is that possible to do that so that you can really get into some of the reasons behind or where those supports need to be made? You know, obviously meeting people where they are, which we've heard a lot about, and that may not necessarily look like a traditional trial design or study design. We're going to have to be thinking outside of the box to actually make an impact. And then the last thing I would say in terms of areas of need that we see, and I would really love to see some thought behind, I think, is in those transitions of life stages. So like we think about postpartum a lot, right? And coverage is one piece of that. But how do you transition a person back to their primary care provider from their obstetric care provider? And what information and knowledge does a person need to carry with them? So if they had preeclampsia or they had gestational diabetes or some other complication, mental health is another huge issue, obviously, which was just mentioned. What do you do with that information? How is that relayed back to your other provider? Why is it just on you as a person to carry that with you when you've just had a baby and, you know, you might have baby blues or worse, you're in COVID, all of this stuff. There's like a lot of burden and stress there to be able to transition it back. And there really needs to be sort of a more comprehensive look at that, I think, as well. And it's going to look different for each person.
Thank you. Any other comments? Let me turn now to another kind of question that came from our audience. This question comes from John Birch with the Mid-America Angels, and he asks about the growing use of real-world data, known as RWD, for regulatory and other purposes. Is this something that can be helpful in filling in maternal and child and pediatric clinical research? Does that mean that we would be able to redesign types of experiments, such as the ones that Kathy referred to? Anybody would like to respond to the use of real world data?
We love real world data. At SWHR, we talk a lot about real world data and value. I think it needs to be explored. I think when we also think about, again, what is of value to someone and what outcomes are important to you is another piece that can be missing. So I think there is certainly more that can be done there, but what really probably needs to be fleshed out is that last piece, right? Like what quality of life are you looking for? What are the barriers that are preventing you from having these outcomes? What are the things that you are struggling with, et cetera, to be able to gather that real world evidence, and then obviously making the case that that should be carried through and sort of throughout these, you know, research projects as well.
Thanks. Just want to let anyone else jump in. I'll go next to another kind of pivot question, which really we hope that you'll be able to inform us around funding and what are the unique challenges, and from all your perspectives on getting this type of research funded. We today during this panel have talked about agendas for the research, but what have been the particular challenges in getting this kind of work supported as compared to more traditional research in the past? And then you may want to think about how we address those challenges.
I mean, I can start. I certainly don't want to be the only one talking. I think from the, at least on the advocacy perspective, I think that it's been wonderful to see the groundswell and the voices, but the voices, again, how can we amplify and lift up and engage so that those voices are heard more? I think, again, going back to the sort of lack of incentive for investing in this type of work has not necessarily been there. I think there's obvious arguments to be made for its importance, but I think, again, what really needs to kind of happen is this groundswell of support and culture change. And it's not necessarily to make more money. It's about doing the right thing and making sure that people are healthy and we're improving maternal health and outcomes and infant health outcomes. But I think that the huge barrier has really been that it's probably more lucrative to conduct your research in some other space. And so to me, that's been a challenge, at least on the federal and the industry side of things.
I just want to add, I know Catherine presented some 2017 data for NICHD, saying that NICHD funded 60% of the NIH research on maternal health. The 2019 data show that NICHD funds 50% of the maternal health data. That doesn't mean that there was a decrease in the amount of funding that NICHD provided. It means that other institutes and centers at NIH saw an uptick in the amount of funds that they allotted towards this topic. And I think that's a direct reflection of what Catherine just stated, right? There's this groundswelling of the importance of this work and why it's important, and people's voices are beginning to be heard, and that's part of the response to that vocalization.
Thank you. Tanisha, do you want to make any comments about how you've seen some of your partners pursue funding and the challenges that they've encountered in terms of research?
Sure. I mean, I think for one, it starts with, for some of them, even saying the word racism in their grant proposals, right, is something that starts as this elimination factor for the way that they're approaching their work. And so when you have people in institutions where they're applying for funding who see that, and that's an automatic, it's an automatic barrier for them to entry. And then I think to that end, it's who's making the decisions in these funding spaces, and do they understand the work enough to be, making judgments on some of these proposals. And so people are putting their work to people who don't understand it, who don't do this work. And so it goes beyond just the word racism making people uncomfortable, but then really elevating outcomes, metrics, measures that are relevant to the community, but not necessarily to the way that that institution has done its work. So you have this real incongruence with the researchers in the field and the people who are making the decisions about funding and what kind of support they're able to receive. And I think that also translates to the way that they experience, even within some of their institutions, of like how their work is prioritized versus others within the hierarchy that exists in, settings of academia. So you've got, I think several factors at play in not only the funding of the work, but then what happens when it needs to be executed at an institutional level.
Thank you so much. Any other comments? Actually, one of our participants just raised a question having to do with the concordance that you just referred to, and maybe others would want to respond to as well. We've all talked about how important racial and cultural concordance is. And can you discuss the intricacies in objectifying race and culture? How do we assess if one is racially and culturally concordant? We know that there are intercultural challenges, like the ones we discussed between yesterday and today: colorism, assimilation, imposter syndrome among a number of us. So these are a number of issues that have to do with the challenges around concordance. So I'm just wondering if anybody would like to respond to that very thoughtful question. Challenging question. Okay. Juanita, do you want to jump in?
It's not a real answer to the question. I don't have an answer to that question to kind of lean back and say, this is what the data show on that topic. But what I will say is that it is important, not just kind of culturally, that the people reviewing these applications and the types of research, if it's for journals, if it's for funding, that at a minimum, they should at least have the background in that particular science, be it the type of methodology or the topic at hand, and not simply just the outcome of a yes, no, but kind of in that theoretical framework as well. And I think that's important, not just kind of the background of the reviewer, but also their knowledge in that space of the theoretical drivers and motivations for the scientific questions.
Thank you. I'm going to ask one last question, and given the importance of advocacy in our field and all the disciplines that we've represented over the last 2 days, could you please comment on how can advocates ensure that maternal and child health equity be prioritized in the broader health research agenda? What do you see as their role?
I can certainly start. I just coming from I think individuals themselves, the voices that we have heard over the last few years has really moved us to the ability to even have these conversations. So I think thank you to all of the people who've participated in this workshop and beyond, because without your voices, we wouldn't be as far as we are. So I would say don't stop talking about it. Keep going to your policymakers and talking about it. Let's think about how we can empower pregnant people, but also researchers and clinicians to be able to continue to lend their voices to these causes as well. And then I think from an organizational perspective, whether you're a small organization or a large organization, coming together with the same message at a time where I feel and hope that the time is right to talk about this. There's a lot of interest on Capitol Hill. There are more women than ever before in those positions who are taking this on. I mean, look at the Black Maternal Health Caucus and all of the work that they're doing to continue to push this conversation forward, but also in the administration. We've never seen a female vice president, let alone a person of color in that position. And so I think that there are opportunities for all of us to just continue to talk about it and push and keep pushing and ask for more, because I think the sky is the limit and the pieces are there, but without those voices, there's not going to be that pressure to be able to do more. So I think the more that you can talk about it, the better.
Thanks so much for that. I just want to give the other panel members any more time. Monique, do you want to talk a little bit about how your foundation is responding to advocacy?
Yes, absolutely. And my apologies if I'm a little choppy. I'm in the middle of a thunderstorm here, so hopefully you're able to hear me okay. But advocates have an important, crucial, and essential and important role to play. There are lots of policy opportunities, lots of, and there's a window of opportunity, particularly now, to really push on policy priorities that can really improve maternal and infant health outcomes. But I think something that's not oftentimes discussed is the role that advocates have in narrative work and in elevating, typically, narrative work in this area, has focused on elevating the problem. But there is also an opportunity to really focus on asset-based structures and solutions that improve conditions. And advocates are very well primed to do this. When we focus solely on the problems and don't identify the solutions and the assets that are based in the community and that are, really pushed forward by community-based organizations and leaders in the community, it really impedes the dollars from being directed toward advancing evidence-based solutions that have been identified by the community, and then reinforces the complex nature of the problem as being one that's too large for anyone to solve. So I do see an opportunity for funders to continue supporting advocates and expanding our own networks and relationships with advocates to really help shift the narrative around some of those asset-based solutions that are really important to consider that are coming from the ground up.
Thank you so much.